Hi, in this video I'm going to talk to you a little bit about the shoulder and neck and why I might treat them both together. So if you came to me with a neck problem, so neck pain, pain radiating down into the middle of your shoulder blades, pain across your shoulders and pain down your arm, why, when I'm saying to you actually the issues with your neck, why I would choose to add in shoulder exercises as well as neck exercises. Okay, well, the shoulder and neck work together in most activities in our day-to-day life. Our neck, obviously, we know that it moves, it turns, it looks right, it looks left, it looks up and look down. But mostly, think about what we're doing everything day to day. We are looking around, but we are push, pull and lifting, writing, doing stuff with our hands pretty much most of the day. The only time that we tend to not use our arms and our shoulders in relation to our neck is when we're sat down watching TV, maybe in the evenings, or when we're laid down in bed. Even think about reading it, we're holding our arms and using our arms if we're reading in bed. The muscles which sit deep inside your neck, the deep neck flexors, are related also to the jaw, but they also have an influence over the shoulder. And vice versa, when we lift, pull and push, the forces and the load is shared from the arm across the collarbone, round the shoulder blades, and it goes up and down our spine. So the forces, the stresses spread over all those joints and structures. If we have a lack of strength or maybe a lack of ability to control those forces and share those loads across the whole of the upper limb, okay, when we push, pull or lift, we can end up with our shoulders and lifting like that. And of course, then look what happens to my neck. If I'm lifting like that, then my chin pokes forward, okay. If we're trying to generate a force, which is pressing down, pushing doors, writing, chopping vegetables, again, if we're not brilliant around our shoulders, we end up with this, and again, the neck takes the brunt of it. So there's so many situations where I see people, clients and patients that I've treated, that when they've had a neck problem, all that's happened is they've been given neck rotation, side movements, and maybe some deep neck flexors or retracting exercises. That pretty much is it. But there's so much more that we can do, so much more we should be doing beyond just moving the neck around. Even if your problem is predominantly a stiffness problem, if you go to therapy and they press on your neck and it feels better after they've mobilized it, we still need to address the reason why it's stiff in the first place. So what sort of things would I do? Well, I would strengthen the rotator cuff muscles. So this is the shoulder, happens to be a right one. Oh, it's the wrong way around, Jen. Oh God. Right one. I'm on my right because I'm looking at you, mirroring you. Okay, so this is the right one, and the collarbone comes across here. So this is your shoulder blade. You can feel it at the back, and it's called the scapula, the medical term for it. This is your arm bone or your humeral head, and this is the collarbone or the clavicle at the front. The only joint to manage to be able to transmit forces from the trunk to the upper limb is this one joint here. Okay, this is called the acromioclavicular joint or AC joint. So that's where the collarbone or the clavicle meets the spine of the scapula here. Okay, and this bit across the top is the acromion. Can you see that? So that's bit here. All right, so you're feeling here across there, and if you went along, you'd be able to feel the spine of the scapula, okay, along here. Now, the muscles that help support the shoulder, okay, are called the rotator cuff muscles, and some people will have heard of those. Rotator cuff muscles, remember, this is coming from behind, come in here, below the shoulder blade, atop the shoulder blade, and underneath the shoulder blade, here, underneath the shoulder blade between the rib cage, and they come in and they hold the humeral head into its joint. So that when you lift your arm up, can you see, when I come a bit closer, when you lift your arm up, all right, the rotator cuff muscles hold it in its joint and allow rotation, all right, so it clears this space here. Now, their job is to hold it in, to stop it moving up and down, back and forth, all right. So if you look sideways on, it holds the humeral head into that very shallow socket and allows this movement, this clearance movement, wherever we're moving the shoulder. So sometimes people can get pain from impingement. Some people will call it supraspinatus inflammation, and that is an inflammatory problem. It's just basically your tendon which sits under here, so the supraspinatus muscle comes up here, top here, comes underneath here. It's just getting a bit nipped and it's unpleasant. Okay, but rotator cuff muscles are really important. There's also the scapular muscles which hold the shoulder blade onto the rib cage. So when you move your arm up and down, as you move your arm, your shoulder blade slides like this. But what we want it to do is sit on the rib cage properly and not either wing that way up or go round too quickly in relation to the arm. They work together as a pair. So there's muscles called the trapezius muscle that comes from here and sits up and attaches onto the neck. And there's middle fibers that come down the neck and across onto the shoulder. So there's a huge amount of relationships between the muscles that support the shoulder blade and help with lift, pull and pushing that also sit and attach onto the neck. Okay, so we need to do both together. You can't separate them because we don't separate them in normal everyday life movement, so we can't separate them in terms of strength and conditioning. So if you're watching this and you're feeling a bit despondent because you've had neck problems, do not despair. There's so much more that we can do. And if you're watching this because it's the front of my neck shoulder plan, at least that gives you some idea of why we're starting to strengthen these muscles and these exercises that we're doing in the plan.